They can have seizures, they can have tremors, they can have vomiting, they can have diarrhea.
The consequence of a heroin addiction is a brutal withdrawal that can put patients under 24-hour monitoring.
It's excruciating to watch. It's excruciating. They're uncomfortable. It seems to last forever.
But the patients being cared for here never voluntarily took a drug or used a needle. They were born into addiction. Collateral damage of a growing heroin and opioid drug abuse epidemic.
It's very frightening. People should be very concerned about it.
Like hospitals across the nation, Women's Hospital and their newborn and infant intensive care unit are seeing a rise in cases of neonatal abstinence syndrome, babies going through drug withdrawals. NAS is the result of heroin or drug use during pregnancy. As mothers use, their unborn child feels the impact. Addiction can override even the most protective instincts of a pregnant woman, making rehab especially difficult. All the doctors here can do is help mother and child while they're under their care.
Sadly, a lot of these parents, their families have no idea that they're addicted, so it's helping them navigate with their families. Like, this is a really great time to kind of come clean and let your family know you're struggling with addiction.
After birth, babies have to be closely monitored for withdrawal symptoms and treated accordingly. How bad the withdrawal is depends on what drugs the mother's used. Sometimes comforting a child is enough to calm symptoms. Other times, medicines like morphine may be required to wean a child's addiction.
When a baby's in the NICU for 40 days receiving morphine, it's excruciating to watch. And a lot of these parents aren't here. You know, our volunteers are holding these babies and rocking these babies. And that's the impact.
According to studies, the number of NAS cases nationwide has increased fivefold in recent years. Babies suffering from NAS typically have a longer, more costly hospital stay, an average of more than $66,000 according to federal data. And that's a bill that is at times footed by Medicaid.
When you take those costs nationally, it's a huge number.
But Dr. Steven Spidell says more concerning, they have no idea how these children will be affected as they grow.
The scariest thing for me is this developing brain in this environment, especially the mothers who use multiple drugs. We just don't know. We really just don't know. When you look like this epidemic in the last 10 years, it just skyrocketed.
Spidell says reducing these cases and keeping babies healthy after they leave the NICU will take everyone in the community, from law enforcement to lawmakers. He says there needs to be an effort to help mothers struggling with addiction early on, and more resources to help them stay clean after giving birth.
By the time I get them, it's too late. The damage has already really been done.
Elizabeth Vowell, WAFB 9 News.